Good afternoon, everyone. Thank you very much for joining us at the slightly later time today. As you can see, I'm joined by Jason Leitch and we'll take questions shortly. Before that, though, I'll give a quick update on the current state of the pandemic and start, as I usually do, with a summary of today's reported statistics. 1,044 positive cases were reported yesterday. That's 5.6% of all tests that were carried out. And it takes the total number of confirmed cases now to 342,059. Now, while, as you have heard me say very often in the past, we should never put too much emphasis on a single day's figures, it is nevertheless, I think, worth mentioning that today's positivity rate of 5.6% is the lowest it has been on a single day since the 19th of June. I can also confirm that there are 472 people receiving hospital treatment. That's 3 fewer than yesterday. And 63 people are in intensive care. That's 2 fewer than yesterday. Sadly, though, a further 7 deaths have been reported in the past 24 hours, and that takes the total number of deaths registered under this daily definition to 7,866. And as always, my sincere condolences go to everyone who has lost someone as a result of the virus. Let me also provide an update on the vaccination programme. I'm pleased to say, firstly, that as of this morning, a new milestone has been passed. More than 4 million people, 4,653,000 to be precise, have now received a first dose of vaccine, and that's an increase of 2,031 since yesterday. In addition to that, 16,826 people got a second dose yesterday, and that means the total number of second doses administered is now 3,108,928. All adults have now been offered a first dose of the vaccine, and 90% have taken up that offer and had the first dose. In addition, approximately 70% of adults have now had both doses of the vaccine. That includes 92% of those who are aged 40 or older. Now, obviously, we'll be working to increase these figures further in the weeks ahead, with a particular focus on the younger age groups. But make no mistake, compared to any previous vaccination programme undertaken in this country, and indeed compared even to our own expectations at the start of the COVID vaccine programme, these are already quite extraordinary uptake figures. And they do show how successful the vaccination programme has been so far. There is lots there for us to be positive about, but as with all aspects of this virus, we're not complacent. We want to see as close to 100% of the eligible population vaccinated as we can get. So if you haven't yet had your vaccine, then it's not too late to do so. Please take advantage of the many opportunities across the country and get vaccinated as quickly as possible. Now, there's one other point on vaccination that I want to take a moment to particularly stress today. The Scottish Government, in line with advice from the Joint Committee on Vaccination and Immunisation, is strongly recommending that pregnant women get the vaccine as soon as they are asked to do so. Vaccination is the best way of protecting against the risks of COVID in pregnancy, and these include admission of the pregnant mother to intensive care and also the possible premature birth of the baby. Already in Scotland alone, more than 4,000 pregnant women have received the vaccine, and there are thousands and thousands more across the world have received the vaccine. The evidence of its safety is overwhelming. Further information is available from the Public Health Scotland website and also from the Royal College of Obstetricians and Gynaecologists. But essentially the message is, if you are pregnant and you're invited for the vaccine, please do get it. It will help you protect yourself and protect your baby. The progress of the vaccine programme is very important, of course, in considering the current state of the pandemic. The Scottish Government, as you know, hopes to lift more of the remaining COVID measures with a move beyond level 0 from Monday the 9th of August. And this time next week, I'll make a statement to the Scottish Parliament setting out whether and to what extent we think we're able to go ahead with that. And what we'll be doing between now and then is weighing up the different factors that will inform that decision. Several of these factors give us really strong grounds for hope, and that's positive, although others remind us of the need for continued caution. So I want to quickly summarise some of those in my remarks today. First of all, there's no doubt, as I've said before and already highlighted today, we are in a much better place than we were last March at the start of the pandemic, or at the beginning of this year, or even at the start of this month. Thanks to vaccination, the very high case numbers we've seen in the past 2 months or so haven't resulted in the same number of deaths or hospitalisations as in previous waves, though I think it is always important to say that every single death and every instance of somebody requiring hospital treatment matters. That's not something we should ever be complacent about. Vaccination is also, though, one of the factors that helps to explain why case numbers in Scotland are reducing as significantly as they are right now. And to give some context to that, case numbers have more than halved in the past 3 weeks. Last week, up to the 23rd of July, there was a daily average of 1,523 new cases. That's down from 3,305 per day on average in the week up to the 2nd of July. The average test positivity rate is also down from more than 10% at the start of the month to just over 7% now. And as I said earlier, the test positivity reported today is actually the lowest we've seen since mid-June. To put all of this in comparative terms within the UK, at the start of this month, Scotland accounted for 5 of the top 10 local authority COVID hotspots across the UK. At this stage, we have none in the top 150 local authority hotspots across the UK. We're now seeing hospital admissions start to fall as well. 421 people were admitted to hospital with COVID in the most recent week. That's down from 577 in the previous week. And as a result of that, we would hope to see the number of people in intensive care with COVID and also the number of people dying also start to reduce soon. So in short, we have seen some very positive developments recently, and that does give us, certainly gives me grounds for optimism that we will be able to continue our progress out of restrictions. That said, we do still need to be cautious. It's good that cases are lower than they were 3 weeks ago. That comes as a relief, I know, to all of us. But they are still 9 times higher than they were at the start of May. And we know that the Delta variant is significantly more infectious than previous variants. So just as a sensible degree of caution up to now has helped us get case numbers back on a downward path, a sensible degree of continued caution in the period ahead will help avoid sending that progress into reverse. It will also help us do something that is really important, make sure we're doing everything we can to protect the most vulnerable in our society from COVID. Now, we know from our own quite recent experience how quickly progress can be reversed, and we see that in other countries right now as well. So while we should be pleased and indeed relieved about our current progress, we should not take it for granted. COVID is still capable of causing serious illness and death, and of course the impact of long COVID should not be underestimated. And the virus can still put significant pressure on the NHS. Indeed, it is doing exactly that right now, because although case numbers are reducing, the lag effect means that we're not yet seeing just as big a decline in the pressure on the NHS. Hopefully that will follow in the days and weeks to come. So these are the factors that we will be weighing up in the days ahead. In short, to try to summarise that, I am confident we will make progress, and while We are already living with far fewer restrictions than has been the case at previous stages of the pandemic. All of us want to see the remaining restrictions eased as quickly as possible. That's important to all of us as individuals. It's very important to businesses and the economy as well. But we will need to do that with appropriate caution and an appropriate degree of care. And we will weigh all of that up in the days to come. I'll set out our conclusions this time next week in a virtual session of Parliament. But for today, let me finish again by stressing the three key things that all of us can do, because all of us have a part to play here to keep things moving firmly in the right direction. The first, of course, is to get vaccinated. Remember, if you're over 18 and you haven't had your first dose yet, or indeed if you turn 18 before the end of October, or if you've had your first dose 8 or more weeks ago, you can simply go to a drop-in clinic to get either your first or second dose as appropriate. There are drop-in sites now in every mainland health board area. You can find out where they are through the vaccination section of the NHS Inform website, or through your local health board's website, or by following your local health board on social media. And you'll see lots of examples right now here in Lothian and Glasgow, for example, of innovative locations for setting up vaccination sites to make it as easy and as accessible for people as possible. That said, you can also book an appointment if that's easier for you, and you can do that also through NHS Inform. Second thing we're asking everybody to do is get tested regularly. You can get the free lateral flow tests through NHS Inform by post, or you can collect them from testing sites or local pharmacies. Remember, if you test positive through one of these devices, or if you have symptoms of the virus, self-isolate and book a PCR test as quickly as possible. And third and finally, stick to the rules that are still in place for now and keep following the basic hygiene measures. All of these things are really helping us get the situation under control. And if we keep it under control, then we have greater chance of continuing to move in the right direction. So meet other people outdoors as much as possible. Having had some good weather in the past couple of weeks, I think we've got a few days ahead of not so good weather, to put it mildly, but still try and stay outdoors as much as you can. If you are meeting indoors, open windows if at all possible. The better ventilated a room is, the relatively speaking safer that's going to be. And for now, stick to the limits on group sizes. In someone's home right now, you can currently meet in groups of up to 8 people from up to 4 households. And lastly, remember physical distancing, hand washing, face coverings. All of these things are as important now as they have ever been. They are helping us get a really difficult situation at the start of this month back under control, and they will help us continue to make the progress that all of us are desperate to see. So thank you again for joining us and listening. Without further ado today, I'm going to move straight to questions and start with Gordon Cree from STV.
Thank you, First Minister. A while ago, years ago, there was a campaign against anti-social behaviour where the slogan was hug a hoodie. I suppose the 2021 equivalent might be don't hug an anti-vaxxer. But do you think that people who've not been vaccinated thus far are essentially guilty of anti-social behaviour? After all, it's not just about protecting themselves. And can I ask Professor Leitch, this most recent peak of infections that we've just seen, the second, third or fourth wave, depending on how you count it, do you think that this is the last wave that we will need to worry about in the same way?
I'll hand over to Jason very shortly. In terms of the question directed to me, I don't think it is helpful or, in fact, it may be counterproductive to treat everybody in the group of people who are eligible for the vaccine but haven't yet been vaccinated as one homogenous group, and I'll come on to that in a second. But it is undoubtedly the case that every time somebody who's eligible to be vaccinated is not vaccinated, then that's one step we could be taking back towards normality that we're not taking. So it's an individual responsibility, and I think it's an individual opportunity for all of us to get vaccinated. But as I've said many times before, it's actually part of our collective civic duty right now to each other to get vaccinated. It's the best way out of this. That has been the case and that remains the case. In terms of your specific question about antisocial behaviour, this is where I would subdivide the group of people who are not vaccinated. And I'll be blunt about the first subgroup of that I'll speak about. If you're an anti-vaxxer who's going around deliberately spreading misinformation about this vaccine, then yes, I would accuse you of antisocial behaviour, because you're putting people at risk by doing that. And I would ask you to think very carefully about that. If you're doing it deliberately, definitely, or if you're just blithely, retweeting or sharing on social media information about the vaccine that is not got any basis in evidence or fact, then you're not helping at all. In fact, you are doing the opposite of helping. But if you're somebody who is genuinely worried about vaccination, because you might be reading some of this stuff, then I would say to you, please just take a bit of time to find out the facts about the vaccine. You can do that in a number of ways. You can, as I keep saying, go onto the NHS Inform website. There are lots of sources of credible information online. Or, again, as I've said a few times previously, turn up at a drop-in vaccination centre. Even if you haven't finally decided you're going to get the jab in your arm, go and talk to somebody. There are trained professionals there who can answer your questions and hopefully put your mind at rest and get the vaccine. So I'm not going to criticise people who have got genuine concerns, but I will not stop trying to encourage you to educate yourself about the vaccine and come forward and get vaccinated. And the last group would be people who are neither anti-vaxxers nor are they people who have got genuine worries about the vaccine, but maybe people who have just got busy lives and haven't managed to get to an appointment. And again, I think we all understand that, but that's where the responsibility is on the government to make it as accessible as possible. We can't go to everybody's front door and vaccinate you in your own home. Logistics of that obviously are impossible, but we are trying to do, and will continue to try to do, everything we can to make it as accessible as possible. So, I refer to Lothian right now working with, forgive me if I'm getting this wrong, I think the Gyle Shopping Centre to try to do accessible vaccination in Glasgow. Sort of clinics being set up outside Ibrox and Hampden, for example. So everything that can be done there, it will be done. So that's why I would not describe everybody who hasn't been vaccinated in the way you invited me to do, but there is definitely a subgroup there that I would not hesitate in using that language for. Jason.
All of the behavioural science says that people want to be vaccinated and they just need the right information in a language, in a literate way that they can understand, and the vast majority will come forward, and that's what we've tried to do. I spent some time last week with Young Scots Health Panel, and then Young Scots Health Panel then ran a big Q&A for Scotland's young people. Not me, they ran it. So they spoke to the young people of Scotland with the correct information, trusted voices to try and help with that group. Let's keep it in perspective. 9 out of 10 Scots have come forward for a first injection. Very, very few people only do one if they're offered a second. So that would suggest we're going to get close to at least 90% of the whole population being fully vaccinated. That I wouldn't have believed that possible 6 months ago. But we want the rest of those people to come forward. The answer to your second question is relatively straightforward, but a bit of a crystal ball, Gordon. I don't think this is the last time we need to be concerned about COVID. Most of the epidemiologists think there will be some kind of winter wave, along with flu and respiratory viruses. We just don't know the scale of it. Vaccination appears to be really helping us now, and we hope booster doses, protecting the vulnerable, and continuing with some hygiene measures, and we'll hear more about those baseline measures next week, will help us keep that to a minimum. But we will treat every wave at the moment we get it in an appropriate way. We've dealt with each wave slightly differently. So we haven't locked down for wave 3, for example. I don't expect to lock down for wave 4. What I would expect that we might have to adjust some things depending on what we find in the data and the advice we give the First Minister.
Thanks. Lindsay Bewes from BBC.
Hi there, thank you, First Minister. Just still on the vaccination programme, I I'm wondering why you think it might be that some young people in particular are perhaps more reluctant to come forward to get their vaccine. And is there any danger that the level of take-up in that age group will affect your decision-making on removing restrictions when you give that update next week? And just to Professor Leitch, when you're looking at the number of people who've been double vaccinated, what percentage are we looking at needing there for community-wide immunity, and what would that percentage need to be in the under 49s age group?
I'm not going to go into next week's decision in any more detail than I've already done today, because it is next week's decision, and I think it's important that I weigh up all the factors. Their vaccination levels, as I've said previously, are one of the factors, an increasingly important factor that we take into account. But I hope you heard today, I am at the optimistic side of the scale right now in terms of the progress we're making, and that is both in case rates and vaccination levels. We do want to get vaccination uptake higher in the younger age groups, but I would reiterate the point Jason has made. In saying that, we should not lose sight of the fact how extraordinarily high uptake rates already are. 9 out of 10 adults in Scotland have come forward, and although uptake rates in the younger age groups are lower, and I'll come on to perhaps some of the reasons for that in a second, they are still high by standards of other vaccination programmes. So, let's keep it in context, but it remains true. Every single individual that gets the vaccine literally is a step closer to normality. So we're not going to let up on trying to push uptake rates as high as we possibly can. But you wind the clock back 6 months, and if you were to tell me the uptake rates that we have today, even in the younger age groups, I would probably have struggled to believe that we would be as successful as we have been. And of course, it's not just Scotland. We're seeing that success replicated in other parts of the UK as well. The second part of your question, Jason may want to say a word about this as well, is more it's to some extent speculative, to some extent based on behavioural science, anecdotal evidence. So some of the concerns I hear from young people are, for example, I've heard young people say that they're worried the vaccination rates affects fertility in both men and women. There is no evidence for that whatsoever, and I think I tweeted something last week actually that there's lots of evidence that can help reassure people on that front. The risks of the virus are probably far higher than the risks of the vaccination in many of these respects. And I think secondly, for young people, perhaps more than for other age groups, there's issues of just convenience and accessibility, and I suppose a sense of, all through this pandemic, young people have heard people like me and Jason and many others say that the risks to younger people are far less serious than the risks to older people. And so perhaps there's just a sense of it's not as important for us to get vaccinated. And again, that's why it's so important to say the risks if you're young might be less than the risks if you're old, but that doesn't make the risk non-existent, not by any stretch of the imagination. You can still become ill, need hospital treatment, need intensive care, and you can still die from this. And perhaps more relevantly for younger age groups, we know you are at risk of long COVID, and there are plenty of stories out there that you can look at right now about how miserable long COVID is for people. So please, if you're in a younger age group and you haven't yet got vaccinated, please think about all these things. Go and find, young people are much more adept than older people at finding good information on social media and on the internet. Go and educate yourself, and please get vaccinated. It is absolutely in your interest, but you're also helping others as well.
The questions I got asked by that panel were exactly as the First Minister's just described. There were a few questions that were a bit more edgy, clearly from anti-vax correspondence and literature. There was then most of it just around general questions about what does it do, how was it produced so quickly, what are the science elements and the safety elements of it, all the same things that the middle-aged and the more elderly ask, maybe just in different proportions. I also think there is something about the disease feeling slightly more abstract if you're young than if you're old. If it hasn't touched your family, your friends, I think it feels a little bit more difficult. But we're trying as much as we can to communicate with those age groups and get them to come forward. We haven't been vaccinating the 18 to 29 group for that long. I expect those numbers to rise. The second part of your question, Lindsay, specifically for me about population immunity percentages, there isn't a magic number. There's quite a lot of myth about population herd immunity. It doesn't suddenly happen that you reach 72.5 and the disease disappears. It's much more gradual. I'm very hopeful that we're reaching those kind of levels now, and that's why our numbers are falling, because vaccination and pre-existing disease, so natural immunity where people have had it, is beginning to turn that corner. That's what we're seeing in Scotland. I think it's probably what we're also seeing in England's data over the last few days, later than our data. The scientists seem to suggest somewhere between 70 and 80% of your whole population, including children, all of your human beings in your population, is where you would reach what they would describe as population immunity. But that doesn't get rid of the disease completely. We've got population immunity for measles. We still have outbreaks of measles. So it's not a magic moment where COVID will disappear, I'm afraid. That's the moment we seek, but it won't quite happen just like that.
Thank you, First Minister. Following last week's update from the JCVI on vaccinating vulnerable vulnerable teenagers, Radio Clyde spoke with Claire Steele and her 14-year-old daughter, Katie, who are obviously delighted with the news, but they've expressed frustration at the lack of information they've had since the start of last week, and Claire feels like vulnerable kids aren't being made a priority right now. So what update can you provide teenagers like Katie who are desperate to get vaccinated so they can get back to a bit more normality?
Look, if I was in Claire's position and the parent of a child in Katie's position, I would be expressing exactly the same frustration. So I absolutely understand that you want to protect your child as quickly as possible. As you said in the preamble to your question, though, we've only in literally the last few days really had that advice from the JCVI. When I spoke about it last week, I said that we were in the process of operationalising that advice, and we will very soon be putting more information out there about exactly in what order and practically how the groups of vulnerable children who are already recommended for vaccination are going to be vaccinated, and we will do that as quickly as possible, while continuing, of course, to keep the focus on completing the adult vaccination programme as well. So as quickly as possible, and I would anticipate very soon we will be putting into the public domain and also communicating more directly with people in this category exactly when and how that is going to happen. But let me just end with an assurance that it is absolutely the case that vulnerable children are being treated as a priority and will be treated as a priority, because we want to see the protection of vaccination extended to as many people as possible. And obviously we are waiting, given that the JCVI continues to consider its advice in relation to younger people more generally. We continue to wait and see whether there is a change to that advice to extend the recommendation to other young people. While I'm not the expert, the JCVI are the experts, I hope we will be in a position to be able to extend vaccination to further groups within society, because I do believe it offers good protection in the groups where it is deemed to be safe and effective. Jack Foster from Global.
Good afternoon, First Minister. Unrelated to Alan's question, I suppose. It's just over 3 weeks until most Scottish school pupils go back to the classroom. And there is a compelling argument that bringing together thousands of unvaccinated young people would act as a petri dish for another wave of COVID as we head into the autumn, or even aid in the evolution of new strains. And given that none of that is particularly groundbreaking news or controversial, and given that we've always known that the school holiday timetable was going to look like this, and given that teenagers are being vaccinated now in parts of Europe, was any thought given to vaccinating, at least in part, school pupils over the summer? And if so, why hasn't it happened? I mean, I know a lot hinges on advice from the JCVI and so on, but there is still time to get teenagers vaccinated before the new term starts. Is there any chance that that's going to happen?
I mean, these are important questions, and as it will not surprise you to hear, they are questions that I consider intensely and discuss with Jason and others intensely, literally on a daily basis. So let me just try and unpack that a little bit and hopefully do that as helpfully as I can. You use a phrase there, and I don't want to pick up too much on the particular phraseology you use, but it's just a way of illustrating my first point, that a lot hinges on the JCVI. That's actually a bit of an understatement. In the lifetime of the Scottish Parliament so far, and people can decide whether this is right or wrong, but in the lifetime of the Scottish Parliament, a government has never departed from the recommendations of the JCVI on questions of vaccination and immunisation. So if at any point I, as First Minister, the Scottish Government generally was to do that, that would be a significant step. And I'm sure we would come under a lot of scrutiny for the basis on which we were doing that. So I'm just saying that to, I suppose, underline how important the JCVI advice is on these questions. And therefore, that's the answer to your question. Why have we not vaccinated teenagers over the summer? Is because we would have been going against the advice or acting at an earlier part of the summer in the absence of advice from the JCVI. And that would have been, I think, if I can say this quite mildly, a very controversial thing for us to have done. So that's that first part. The JCVI issued advice on vaccinating vulnerable young people last week. It is, as it said at the time, it is considering continuing to consider this question. In a nutshell, what I think, if young people are unvaccinated and they get the virus, the question I am asking through expert advisors, the JCVI, is there's a pretty binary question here. Is getting the virus for a young person more or less dangerous than getting the vaccine? Now, if getting the virus is more dangerous than the vaccine, my view would be the answer should be vaccinate. If getting the vaccine is more dangerous than the virus, the answer would be don't vaccinate. So it's quite a binary question, and that's what I am keen to make sure we have got very, very solid advice from the JCVI around. And I know the chief medical officers across the UK have, sort of communicated with the JCVI on these points. Our own chief medical officer has also written, or is writing today, to the JCVI around some of these things, but also making the other point you made, that our school term starts earlier than school terms in other parts of the UK. So there's not a unique urgency in answering these questions for the Scottish Government, but there is a particular urgency in answering these questions. So, I am very anxious to get to the point, if it is the case that vaccination can help mitigate against a greater risk in it, if it is that the virus is a greater risk for young people, that we get to that position as quickly as possible. And other governments in other parts of the world are taking their own decisions. I see the Republic of Ireland has decided to go in a particular direction today. The only other point I would make is around wider mitigations in schools, because vaccination is a big part of this, but with or without vaccination of teenagers, there are questions about our approach to self-isolation when schools go back, continued use of face coverings, distancing, ventilation, which increasingly is a big part, I think, of what we've got to do to protect against the virus. And we session with officials and advisors on this just yesterday afternoon, and next week, probably around the time I make the statement to Parliament I've already spoken about, we will set out then our expectations of the wider arrangements and mitigations that will be in place for the start of the new school term. So apologies for taking quite a while to answer that. I'll see if Jason's got anything he wants to add.
Nothing else.
And I'll move on in that case. Tom Eden from PA.
Thank you, Minister. Good afternoon. Last month you said, and I'm quoting directly, by 26th July we expect to have given second doses to all 40 to 49-year-olds. But last night you described accusations that this target was missed as downright inaccurate, even though by then just over 90% had a first dose and 76.6% had a second dose, a 14.1% gap between the two. In the next sentence you read out in Parliament, you said by August the 20th, all 30 to 39-year-olds will have had a second dose. As things stand, just over 80% have had a first dose and 37% their second. So is that going to happen, or is there another target?
Okay, I'm really glad this has been raised. I'm only slightly disappointed that it's you that's raised it, Tom, because you're about to probably get the sort of the full blast of my answer here, and you don't really deserve it. When I communicate, and I apologise if this is an error, okay, I kind of communicate at a level where I assume a certain level of intelligence on the part of people listening to me, because I think that's justified, and I assume a certain ability to attach context and common sense to what I am saying. Now, I'll go from there to taking what over the last couple of days has appeared to be an interpretation by opposition politicians and by some journalists that when I said what you've just read out there, what I actually meant was that I was giving a guarantee that by a certain date 100% of people would not just have been offered the vaccine, but would have had the vaccine. Now, all I would say is if that is genuinely what people, journalists, opposition politicians, thought I meant, and that I had committed to that without compulsory vaccination, I'm genuinely really surprised that there wasn't a clamour of questions. In fact, I don't think there was a single one asking me how on earth I was going to deliver that commitment. How could I, without saying vaccination would be compulsory for every person with no exception, even if they'd had the virus within 4 weeks, which right now means you can't get vaccinated, unless I was saying that, how could I possibly have guaranteed 100% uptake of a voluntary vaccination programme? And that's what I mean by saying, and maybe I need to not make the mistake of assuming a level of ability to put context and common sense around how I communicate things. Everybody with any thought attached to it would have known, not least because it's what all governments across the UK are doing, is that what I was committing to, which is what we have delivered, is making sure 100% had been offered an appointment for a vaccine. Short of compulsion, how could I have said that I was guaranteeing it would be 100% uptake? So let's just apply. So what we have done is make sure that we've delivered on the commitment to appointments, and we continue to work to get uptake levels as high as possible. They are already extraordinarily high, but particularly in the younger age groups, we want them to get higher. The last thing I would say is I hope I can sometimes stand at this podium and sound irritated, and I'm sure I've just done that, and if that's the case, I apologise. This is not just any old political issue. This is a global pandemic. It really matters, and all of us, scrutiny on the government matters, and even if I sound irritated sometimes about that, I know how important that is, and I don't shy away from that. But surely we should all try to have grown up, sophisticated, nuanced discussions. And the most important thing right now is not getting into some kind of dancing on the head of a pin debate about what I meant when I used a particular word, but how do we go from the sensible position we had, which we've met in terms of the target, to all of us trying to persuade those who haven't been vaccinated to get vaccinated. That's what I'm focused on and will continue to be focused on. So again, Tom, apologies to you because that rant probably wasn't something you entirely deserved, but there you go. Conor Matchett from the Scotsman.
Thank you, First Minister. I don't ask who that was intended for if it wasn't for Tom.
But if you tempt me a bit more, I might tell you, or I might not.
Can I ask how many individuals have been offered an appointment for a COVID-19 vaccine in Scotland, and also for the three youngest age groups, 18-29, 30-39, 40-49, how many did not appear at their offered appointments? And also, will the Scottish Government publish figures of the number of daily scheduled appointments versus actual uptake since the start of the vaccination rollout? And secondly, if I may, the Scottish Government undertook an as yet unpublished and secret lessons learned review into its handling of COVID-19. Can I ask, have you had a sight of it? What does that review say? And what's your reaction to it? And when will we see the first evidence session of Scotland's own public inquiry into the pandemic?
I'm not entirely sure, which is probably my fault, not yours, exactly what you're referring to in terms of the secret. I mean, heaven forfend that the government occasionally does a little bit of private reflection on the things that might have got wrong and right before then sharing that. It doesn't always make it secret, maybe makes it sensible. So I don't exactly know what you're talking to, so I'll come back to you on that. We are considering right now the next steps on a public inquiry. I remain committed to what I've said before, is that we want a public inquiry to get underway before the end of this year. We have, and if I was refusing to do this, I'd no doubt be getting pelters for this as well, because the UK government has given a commitment to a public inquiry. We're having discussions with them about the extent to which Scottish issues might be covered in that versus Scottish issues requiring to be covered in a standalone Scottish public inquiry. There is no dubiety about the fact that there will be a public inquiry that covers all relevant Scottish issues in terms of the handling of this pandemic. And the final point I would make, again, sorry if I'm going into sort of, the nuanced part of this, is anybody who's read the Public Inquiries Act would know it's not for me to say when the first evidence session of a public inquiry would be, because you appoint somebody to lead the public inquiry, and then by statute I'm not allowed to interfere with how it goes about its business. So I can't tell it when it should do its first evidence session. That would be for the public inquiry to decide. So again, just a little bit of kind of factual context around all of this sometimes I think would stand us all in good stead. And in relation to the first part of your question, all adults have been offered their first dose, and all adults are then offered their second dose 8 weeks after their first dose. Those were the targets we set. Those targets have been met. Exactly how many people that is, I don't know off the top of my head. I've just told you today more than 4 million people out of a population of 5.3 million or something have actually had their first dose, and everybody who's eligible has been offered their first dose. In terms of will we publish breakdowns on a daily basis of, I'm sorry, didn't quite catch exactly what you were asking us to publish daily breakdowns of. We will consider that, and we will consider whether that adds anything useful to the information and whether it justifies the time that then takes from people who have got lots of other things to do as well. Jason, do you want to speak for a minute? Because I'm speaking too long.
Only to say that if 4 million people is 90%, that would suggest there's 400,000 to go. So 4.4 million would be the number of eligible adults to get their first dose. So that would suggest there is 10% of the population still unvaccinated with a single dose. They will, of course, spread across all ages. Some of them will have COVID, can't be vaccinated. Some of them will have immunocompromised positions where they cannot be vaccinated. So you could never get to 100, but we've got to 9 out of 10.
And final point on that, actually, and I think, and I'll be corrected if I'm wrong in this, but when I was looking at the dashboard last night, the UK-wide dashboard, if you look at this as a percentage of eligible adults on first dose, I think we're now, as of last night, we're now equal with Wales as the two top countries of the 4 in the UK. And actually, I think as a percentage of the total population in first doses, we are the leading one of the 4 UK nations. So again, I will do everything in my power to get as many people vaccinated as possible. But the idea that this vaccination programme is anything other right now than a resounding success has no basis in reality whatsoever. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just want to go back to the vaccine target. Do you have a target date to finish the vaccination programme as things stand for all adults to be fully vaccinated? Is that still around mid-September, or has the slower uptake pushed that back? And just secondly, Professor Neil Ferguson said today that he is confident by late September, October, that we will be looking back at most of the pandemic. Is that something that you agree with? Is that something that the figures that you and Professor Leitch see, are you in the same kind of space as he is right now, believing that that's where we'll be?
On the first point, again, I try to do this as simply as possible and not assume anything around it. And I think I've answered this question, the first part of this question to you before. Apologies if it was to somebody else. And let's be clear what the target is. The target is to offer appointments to everybody in the eligible population. That has already been done for the first dose. Those who haven't turned up, we won't give up trying to get them to come, but appointments have been offered to all adults already. That was by the middle of July. Remember, originally we thought that would take to the end of July. We did it by the middle of July, and therefore all the target of having all second dose appointments offered to people will be 8 weeks on from that, which is mid-September. So that's when the target of, which is the only target within our control, remember, entirely within our control, of offering appointments is mid-September. I think that's the part that I've answered before. In terms of when, if, will we ever get to 100% of eligible people being vaccinated? Unlikely, because there will always be reasons why some people are not vaccinated. My own colleague, the Public Health Minister, got vaccinated with her second dose today. Yesterday. And that was delayed because she had COVID. And the rules say, if you have the clinical advice rather than the rules, say if you've had COVID, you've got to wait 4 weeks in order to get a dose of vaccine. So we're unlikely to get absolutely to 100%, but we want to get as close to that as possible. And I can't tell you when we will get to the point where we think we've literally exhausted every possible way of vaccinating as close to 100% as possible, because I'm not sure we'll ever give up trying to do that. But the targets we set are for offering appointments, because without compulsory vaccination, no government with any sense would go to the uptake target, because that's not entirely within your control unless you compel people to get vaccinated. So I hope that is clear. On the second part of I've only briefly seen Neil Ferguson's comments. I would love to think that's the case. One of the many things I've learned over the course of this pandemic is that predictions, this virus is a horrible way of proving our predictions wrong, and therefore I think I would rather just focus on doing all the things that we're doing just now to get things back under control, to keep it under control, to minimise any winter wave that we get. But maybe Jason wants to say a bit more about that.
First of all, on the offering the vaccine thing, let me be clear. Today, it's the 27th of July, there are drop-in clinics available to all of those people who haven't been vaccinated. So consider that your offer. If you haven't had an appointment, or it's gone missing, or you didn't turn up, they're available now. There are vaccines available for you today. That's the offer. If you have an appointment tomorrow or the day after, feel free to attend your appointment. But Scotland has vaccine for everybody who hasn't been vaccinated. So that's the offer. It's complete. I was on the radio with Neil this morning. I didn't hear him say that. He maybe did further interviews, so I haven't seen his comments. He wasn't quite as optimistic during the interview he and I did first thing this morning. He was still talking about 100,000 cases in England and was very relieved that England's cases had begun to fall. I think he, like everybody else, is worried about the winter. I hope that September, October will be looking back on wave 1, wave 2 and wave 3, thinking and breathing a sigh of relief that we're through that bit of the pandemic in the UK. But you just need to look around the world, and you should remain concerned. France is accelerating, the US is accelerating pretty dramatically, and the population of the world remains largely unvaccinated. So we are not through this. We are doing well in Scotland just now, but we've said that before.
Dan Vevers from The Sun.
Thank you, First Minister. After the Health Secretary's muddle over child hospital admissions last month, you'll be aware that the Office for Statistics Regulation said that, if possible, you should include in published stats whether hospital admissions are because of COVID, or if the primary reason for admission to hospital was for something else. The regulator also highlighted this as a data gap back in December. Are you going to do this? And if so, when? And related to this, you may have also seen reports this morning of NHS data in England showing that 56% of COVID hospitalisations are patients who only tested positive after being admitted. Can you give us an indication of what proportion of people have been admitted due to COVID in the third wave as opposed to testing positive after admission? You must have some idea.
I don't have those figures to my fingertips. I'll try to get them for you. If they're available, I'll pass them on. I did see the story I think you were referring to, and apologies, I should probably insert this caveat. I didn't read it in detail, but when I read the headline and the summary of it, my initial thought was there can't still be, forgive me, there can't still 16, nearly 18 months into this pandemic, journalists who don't understand the definitions that we're using around case numbers, hospitalisations. If there is, then we're happy to set that out. But what I saw this morning, my initial reaction was, seriously, is that something that wasn't already well understood? And we'll try to get you the information you've asked for. On the first part of your question, I'll just hop over the ridiculously pejorative description of Humza Yousaf's interview when he was perfectly reasonably trying to give some context to concerns about parents over the risk to children. I will need to come back to you on whether we're going to publish any more detailed information, and I'll do that as quickly as possible. Unless you...
I don't have the numbers. I don't really understand this distinction quite as neatly as you, Dan. If you have a stroke and you end up in hospital, that's a tragedy and horrible for you and your family. If you then catch COVID, your recovery from your stroke will be delayed and worse. So having COVID in hospital, catching it in the hospital, or arriving in the hospital not knowing you've got it, probably more likely, and then testing positive while you're in hospital for your stroke or your broken leg or whatever else, makes that care harder. So it's still a bad thing. So the hospitalisations along with COVID, clinically, they don't make a lot of difference to us.
Indeed. Paul Mallock from Courier.
Good afternoon, First Minister. I was wondering, first of all, if you would be able to give a few more details regarding vaccine to pregnant women, whether or not you have a target for how many pregnant women you want to see vaccinated in a certain time period, round about when pregnant women, what part of their pregnancy they can expect the vaccine up to, and whether there's any concerns about what type of vaccine they should be getting, whether or not that's the Oxford or the AstraZeneca or one of the other types, and also in anticipation of the drugs death statistics being released this Friday, can we expect the coronavirus to have had what sort of effect can we? Sorry, I'll start again. What sort of impact can we expect the coronavirus to have had and the pandemic on these figures, and are we being braced for the worst?
Look, on that latter question, I'll talk about the drugs death stats, and no doubt the Drugs Minister will talk much more about the drugs death stats when they're published later this week on Friday. I think they're being published. If I was to try to preempt those statistics, I would no doubt have somebody reporting me to the Chief Statistician and questions next week about why we'd done that. There are rules around statistics. What I would say is that the drugs death toll in Scotland, as I have tried to be candid about, is far too high, shamefully high, and we've got to do more about it. And we are doing a lot now to try to bring those numbers down, and we take full responsibility for that. I think contextually it's important to remember that the figures that will be published this week predate much of that activity, so I wouldn't expect that those interventions yet to have an impact on those figures. To what extent COVID might have had an impact on those figures last year, we will have to see what the statistics show and then consider that in the round. But no doubt there'll be a lot more discussion about that when the figures are actually published later this week. On the question about vaccination of pregnant women, I'm not going to get into any of the sort of clinical questions around that. Jason might or might not want to say something, but as I said earlier on, there's information on the Public Health Scotland website, and the Royal College of Obstetricians and Gynaecologists also has information available. On the timing of when vaccination will be offered, we want to see all eligible pregnant women vaccinated, just as we want to see all eligible people vaccinated. All adults will have been offered a vaccination already, and it comes back to the same point we've been covering a lot today. It's now about trying to get uptake of these offers as high as possible, which is why we're taking the opportunity today to particularly stress the importance and the safety of vaccination for pregnant women.
Any time during your pregnancy, the vaccine appropriate to your age group, and discuss it with your vaccinator.
Dan Sanderson from Telegraph.
Thanks very much, First Minister. Just on the question of the public inquiry, one of the things the SNP promised to do within the first 100 days of a new administration, if it won the election, was to take the necessary steps to establish a COVID-19 public inquiry in order that lessons are learned for the future. I think 100 days from the election will be August the 14th, so can you just confirm whether we'll have a Scottish inquiry set up by then? And also, if I just follow up on your response to Jack's question on the issue of vaccinating kids. Sorry if I missed it, but can you rule out going against the JCVI on this question? I mean, obviously it's a very finely balanced thing, and respected experts in other countries have taken a different view. So is it just that you're waiting to see if their advice changes, or could you go against them and rely on other experts? Thanks.
Look, I think it's important that we listen to the JCVI. We've never gone against JCVI. I'm not going to predict into the future what might or might not happen in future. The JCVI is looking at this on an ongoing basis. I think it understands how anxious, I'm sure all governments across the UK are to make sure we get this right. And if we are going to end up in a position of vaccinating young people, we end up there sooner rather than later, so that young people get the protection of vaccination as quickly as possible. But I don't think there's anything else I can usefully say on that right now. And on the public inquiry, we will meet the terms of the 100 days commitment we made, and we'll set out further detail on that as soon as we have got to that position. Alistair Grant from the Herald.
Hi there, thanks very much. Just to go back to the 40 to 49 age group, and apologies if this was brought up and I maybe missed it. Is there any kind of thoughts on the reasons as to why there's that gap between the people who have come forward for their first jab but have not come forward for their second? Because those people are clearly happy to be vaccinated. They're not reluctant, but they're just not turning up for that second appointment. Is there any kind of reasons for that? Thanks.
Well, most people are, which is the first thing. So this is and there'll be a variety of reasons. We have covered these issues in quite some length, although to be fair, Alistair, not the specific point you're making about the gap between first and second doses. I would guess, and please, this is a guess of mine, it's not based on any hard evidence, is that may be because that is clearly not, well, okay, there's maybe one caveat to that I would make, but it's clearly not about a sort of fundamental hesitation for vaccination. It's maybe more about practical issues. You can make your second appointment, which is why I would stress the drop-in clinics or the ability to rearrange appointments. Or maybe, and this is what, is again even more so a guess on my part, if you had your first vaccine and maybe didn't feel very well after it, then maybe that would increase your hesitation. But as somebody who didn't feel very well, not in a serious sense, but just that kind of tiredness, headache, a bit fluey after my first vaccine, I can assure you I felt absolutely fine after my second vaccine. So if that's your reason, don't let that put you off.
I don't see a particular challenge in the data. Some people will of course be delayed. They might be on holiday. They might find the second dose harder to get. I think that number will increase and get very, very close to the first dose number. For exactly the reasons you say, people are willing to be vaccinated. Some people did have some side effects after dose one. That is, it appears in the literature, slightly less likely after dose two. Some people get it the other way around. It's difficult to tell. But all of the side effects are better than COVID.
Thanks. Mark McLaughlin from The Times.
Good afternoon, First Minister. Back to pregnant women. Would you like the gap to be closed for pregnant women, the gap between doses, given that the risk is highest in the third trimester? Some women might go their whole third trimester without getting full protection if they only get their first vaccine at the start of it. And secondly, you've said a couple of times that you've never gone against the advice of the JCVI. But when Maureen Watt, the former Public Health Secretary, rejected calls for a Scottish JCVI 5 years ago, she said that you had taken a different tack on the HPV vaccine and the meningococcal vaccine. You did it faster than England. Is that situation different than the situation we face with the coronavirus vaccines?
I need to go back and check those examples. That sounds to me from memory, although without checking I can't be sure about this. Doing something at a faster pace is not the same as deciding to vaccinate different groups. Or going against the advice. So I'd need to look at that, but we follow JCVI advice. That's not something unique to this government. All previous governments in the lifetime of the Scottish Parliament have done that as well. But I'll come back to you on the detailed points there. This is not some issue of ideology. This is just about, I'm not qualified to say who should be vaccinated and who shouldn't be. We need to have expert advice, and if it's not the JCVI, then the question is, who is that? We can't just, and this leads on to my answer to the second part of your question, issues of who gets vaccinated on what basis, and at what dosing interval is not down to what I would like. I mean, we're really in trouble if we get into vaccination policy being based on what I might like to be the case. That's not how we take these decisions. So whether I would like it to be the case that pregnant women got their second dose earlier, that is not the advice we've got. And you, I'm pretty sure, and I would hope this is the case, you'd be one of the first jumping on me to say, why am I randomly coming up with different advice from the experts in relation to pregnant women? The dosing advice from the JCVI is that 8 weeks strikes the best balance between speed of vaccination and maximising the efficacy and the longevity of the protection from the vaccine. And that's the advice we've got, that's the advice we are working on the basis of right now, and that is the case for pregnant women as well. Jason, do you want to add?
No, that's it.
Tom Martin from...
It's just a follow-up on something Global said that I don't think got picked up. Debbie Steedar's worried about children being a petri dish for new variants, potentially ones that can escape the vaccine, and their parents, teachers, and maybe even be more harmful to children. Is that a realistic threat, do you think?
Look, I don't know if you were on earlier on. I'm trying to be as open and as straightforward on the issue of vaccinating young people. I understand exactly why Devi is saying what she's saying. I've spoken directly to Devi about these issues. But I cannot just decide myself as a politician who gets vaccinated and who doesn't. I've got to have a basis for that. And the basis in this country right now is JCVI advice. But the issue is, and this is an issue that I know has been put to the JCVI for consideration by the 4 CMOs, this is a binary thing. If unvaccinated children are at risk of getting the virus, as I think we can see they are, even although everybody thinks the risk to them in terms of illness is much lower, then is the JCVI view that the risk of the virus is less than the risk of the vaccine, in which case you don't vaccinate, or is the risk of the virus higher than the risk of the vaccine, in which case you do vaccinate? That's the very binary issue that we need to make sure on an ongoing basis, as evidence develops, we have clarity and robustness from the JCVI, and that's the basis on which we are taking decisions right now. Tom Martin from the Daily Express.
Hi, good afternoon. Thank you, First Minister. Can I turn to NHS pandemic recovery? Figures this morning have shown the worst accident and emergency waiting times since January 2018. Do you accept criticism that there is a crisis in the health service, and just when can patients start to see any improvements? Thank you.
I don't think, Tom, I have a choice in whether I accept criticism or not. It comes my way almost regardless of what I do and say, and whether I like it or not, and that's as it should be to some extent, although sometimes perhaps anyway. But Jason, I can feel Jason say, answer the question. There is a big backlog in our health service. That's not unique to Scotland. It's the case in all 4 nations of the UK, and it will be the case in many other parts of the world because of COVID. And we are very keen to continue and accelerate the pace of recovery of that backlog. That will be held back any time we have a resurgence of COVID that is leading to significant numbers of patients with COVID being in our hospitals. Every bed that has a COVID patient is a bed that is not there to treat non-COVID conditions. So that's one of the reasons, not the only reason, why we need to get COVID rates down as much as we possibly can and avoid a resurgence. In terms of the A&E waiting times, there is undoubtedly a big COVID impact on that, but as I think we all know, the flow of patients into and through our National Health Service is complex, and therefore there are issues around the reasons for which and the circumstances in which people are presenting at A&E, whether that's always appropriate or whether there's better places for them to go, and often the speed at which people will go through A&E will depend on the pressure elsewhere in a hospital. So some of that right now will be COVID, but there are other factors at play around all of that as well, which is why we're doing a lot of work around supporting and encouraging people to go to the most appropriate place for care rather than everybody almost by default going to A&E. But NHS recovery is a big feature of all of our work right now, and will continue to be the case for quite some time to come. Do you want to add anything on?
No, I think that's good.
Okay, that concludes the questions for today. So thank you to everybody for joining us online. Thanks to Jason for the help. Thanks to Anna for our BSL interpretation, as always. And thank you to you for joining us. I think, in summary, the news today is good. Everything's going in the right direction. We should be really positive about that. But it doesn't happen by accident. It's the care and caution and continued forbearance around some of these restrictions and mitigations that is, as well as vaccination, obviously, that is getting us into this stronger position. And therefore, some of that is going to be needed for a period longer to keep us in that position. But I will set out where I think we are and what that means for future restrictions a week today before the Scottish Parliament, and we will intimate whether there's any briefings between now and then. But failing that, I will see you next Tuesday, and thanks very much for joining us.